Exercise guidelines after surgery. First 2 weeks after surgery. Light activities such as walking and stairs are okay. Walking is encouraged after surgery to avoid blood clots in the legs. Other than light activity, no exercise is advised during the first 2 weeks after your surgery. And the most important rule to remember, always use pain and common sense as a guide for activity. After 2 weeks post-surgery, avoid activities that cause pain. If pain occurs with activity, then stop. Incisions may hurt after activities. Avoid exercise that cause straining or use of abdominal muscles. No abdominal exercises such as abdominal crunches, core exercises, or yoga until more than 3 months post-operatively. No heavy lifting that causes straining, grunting, or use of abdominal muscles. After 2 weeks post-surgery, lifting limit of 40 pounds. Light upper body exercises are okay if no pain occurs. No golf ball driving for 6 weeks. Light putting of golf balls is okay. After 2 weeks post-surgery, okay to submerge incisions underwater for swimming. Light swimming, bike riding, and the elliptical trainer are okay if no pain occurs. Avoid jogging or high-impact activities until after 3 months. 6 months post-surgery. No kickboxing or contact sports until after 3 months. For up to 6 months after surgery, mild incision pain may occur for a couple days after exercise. If there is severe pain or swelling, or if there are any questions or concerns, you should contact your surgeon. Thank you for watching, and visit our website at www.baysurgicalspecialists.com for more information.